Good evening and welcome to Newswatch on Hope TV with me, Melissa Oduor, as I bring you the latest updates as far as news is concerned. Thank you for joining us on this live broadcast. Our sign language interpreter is Boniface Mureithi. The Ministry of Health has extended the working time for restaurants from 5 p.m. to 7:30 p.m. Making the announcement, Health Cabinet Secretary Mutahi Kagwe said the restaurants must, however, demonstrate stringent COVID-19 health regulations prior and during the opening of the establishments. Meanwhile, the country has today recorded 133 new positive COVID-19 cases in the last 24 hours. Our reporter Alice Diana reports.
Restaurants can now sigh with relief after the Ministry of Health extended their business operation hours to 7:30 p.m. This is another 2 hours 30 minutes extension from the last one made on Saturday. Health Cabinet Secretary Mutahi Kagwe had previously increased eateries' operation time to 5 p.m. after the extension of the national dusk to dawn curfew from 7 p.m. to 9 p.m. Addressing the press from Afya House in Nairobi, Kagwe, however, warned that all eateries must observe all government measures or risk having their license permanently revoked.
Wenye mahoteli ambao leo hii tumewaruhusu kuongeza masaa ile wanafanya kazi, wenye mahoteli na wateja wao ni lazima wafuate ile mikakati ambao tumeweka ya kusaidia na kuzuia hii virusi ya COVID-19. Kwa hivyo sisi tungetimiza ya kwamba wale ambao wanafanya kazi katika hiyo mahoteli, tafadhalini mjaribu sana mfuate hizo sheria, kwa sababu nyinyi ndio mnaweza kuambukiza wale wateja ambao wanakuja hiyo hotelini.
Also relax our protocols requiring a retest by the hotel workers after 14 days of fast testing. Kagwe also urged eatery owners to release their workers on time in order to avoid bleaching of the curfew directive.
Wenye mahoteli umsaidie sana wafanyikazi ndio waweze kufika nyumbani. Wasije sana tena tukasema waendelee mpaka saa 1:30, alafu kutoka hapo mnawaambia sasa ni kusafisha, kutoka hapo sasa sijui ni kupika ile ya kesho leo, alafu sasa wanachelewa. Wakifika huko barabarani wanakutana na polisi kwa sababu wamevunja sheria.
Meanwhile, 133 people have tested positive for the deadly virus for the second day today, raising the country's total confirmed positive cases to 3,860. The new cases emerged from 3,255 samples that were tested in the last 24 hours. Kenya's cumulative tests now stand at 121,956.
We are delighted to report that we have discharged 40 patients from various hospitals, bringing the total of the recoveries to 1,326. Unfortunately, we have also lost one more patient to the disease, bringing the total number of those who have perished and succumbed to this virus to 105. Our thoughts and prayers are with the families and friends during this very difficult period.
Most of the new cases are from Nairobi, which recorded 86, followed by Mombasa at 27 and Kiambu 7. Busia County registered 5 cases. Kilifi, Kajiado and Migori have 2 cases each, while Machakos and Murang'a counties registered 1 case each. Kagwe also sent a warning to Kenyans who are breaking the directive on cessation of movements in and out of Nairobi, saying they might transmit the novel coronavirus to other parts of the country.
Vile tumefahamishwa ya kwamba kuna watu wanavunja sheria ya kutoka ama kuingia hapa Nairobi bila sababu maalum. Tumejionea sisi wenyewe juzi tulipokuwa kwenye Nyandarua, wakati wa kurudi unaona magari ni mengi sana. Kwa hivyo tunawaomba watu wanafanya hiyo kuvunja sheria. Tunawaomba jameni, tunawahimiza, nyinyi ndio ambao mtaeneza hii maambukizi ya virusi huko upande wa mashambani mkifanya hivyo.
Despite tough containment measures put in place, which include the night curfew that starts 9 p.m. to 4 a.m. and the cessation of movements in counties which have recorded high infections, the COVID-19 cases have been on a sharp increase in the country lately. For Hope TV Newswatch in Nairobi, I'm Alice Diana.
The Kenya medical patients when they seek medical attention. Here is Grace Wangoi with that report.
A patient can walk in with other symptoms that are not related to the respiratory complaints of COVID, but actually turn positive later. And that is what has actually contributed to health worker infection.
The Ministry of Health has reiterated that most positive cases in the country are from asymptomatic patients. That's the reason why the Ministry of Health launched the Home-Based Care Action. Health Cabinet Secretary Mutahi Kagwe has continuously called on Kenyans to treat everyone as if they were already positive. Dr. Chibanzi Machonda, in his capacity as a Kenya Medical Practitioners, Pharmacists and Dentists Union KMPDU's advocate, painted a picture of the importance of healthcare workers having personal protective equipment, PPEs, as they are usually the first points of contact with the patients.
As of Friday last week, we have 84 healthcare workers infected with COVID across the country. And so to reduce that infection and to ensure that healthcare workers are available to serve Kenyans during this COVID-19 period, the protection needs to be amplified and ensure that we have adequate protection for all the doctors.
Speaking during the donation of 67,000 masks from GlaxoSmithKline, GSK Kenya, Dr. Machonda, while appreciating the efforts by the private sector in rising to the challenge of equipping healthcare workers, stressed that the government needs to also step up and provide the PPEs. On his part, GSK Kenya General Manager Jojo Nyango said the masks are 3-ply types of surgical masks aimed towards the protection of healthcare workers. He further saluted healthcare workers for their dedication and potentially risking their lives.
Who are battling the disease with passion and with commitment, many times at considerable risk to their families. And because we come from a country that is challenged in terms of resources, we all understand that sometimes the PPEs may not be fully available from the traditional source, which is the national government.
This comes even as the Kenya Medical Practitioners, Pharmacists and Dentists Union has set up a Caring for Carers Fund in response to the dire need of which are in short supply in the country. Through the fund, corporate organizations can channel their funds to support the cause.
Back in April, in the beginning of April, we resolved to create what we call the Caring for Carers Fund that was meant to support healthcare workers, and more specifically our doctors, to get personal protective equipment as a union. Even as we continue advocating for that, we decided that as a union and to protect our members, that we also take an initiative to ensure that we seek partnerships and provide protection for our members.
Reporting for Hope TV Newswatch, my name is Grace Wangoi.
The U.S. Ambassador to Kenya, Kyle McCarter, has donated close to over 24,000 face masks and other personal protective equipment to the National Police Service Commission, NPSE, that will be used by police officers in duty and other civilian staff in police stations. NPSE Chairperson Eliud Kinothia received the equipment and pledged to work closely with the U.S. Envoy's office as the Commission continues to serve Kenyans in terms of security sector reforms and reforms in the National Police Service. The U.S. government is providing 5 billion shillings in additional assistance to boost Kenya's COVID-19 response. Through the American people's generosity, the U.S. Embassy in Kenya says the U.S. government will continue to be a reliable, transparent and steadfast partner to Kenya.
And this, we did agree sometime last year when we visited the U.S. and we agreed on a number of targets and programs that we have been pursuing for long. And the presence of the ambassador here today is actually partly to also reaffirm our commitment to continue with the transformation journey of our security sector. We know that COVID-19 situation has affected every sector in Kenya. National Police Service officers are also part of the Kenyan society. We have numbers that have been released every afternoon. We are now at around 3,000 or so nationally. And among those, we cannot lack police officers who have also been affected.
Machakos Governor Dr. Alfred Mutua has asked the national government to consider extending the nationwide curfew after it was introduced as one of the measures to curb the spread of coronavirus. Governor Mutua says the curfew has heightened security in the country, considering that many people fear walking during the night, hence increased security that he says has ensured peace and tranquility not only in Machakos but across the country.
We are not supporting the curfew because we want our people to get out and make activity and have money. But I'll ask President Uhuru Kenyatta, if you're going to withdraw the lockdown and other things sometime in the future, pengine utuachie curfew kidogo kwa muda, ndio tulainishe wale ambao bado hawajaiva vizuri, ndio tukue na security. Because akiondoa curfew immediately, you'll see crime coming up. And so maybe the curfew should be massaged pole pole tu, so that by the time imeondolewa ata beef up inspectorate wetu, pataenda pia na askari wako na bunduki na pingu na kila kitu bila huruma yote.
Let's now take a short commercial break. We'll be right back. Keep it Hope TV.